So we've covered a lot of topics with respect to PTS, and we've given you some resources to take a look at, both from the standpoint of um, products that can really help you with the particular condition, the terpenes, which are really key, what to talk to the dispensaries about, and also some backup resources that are there. I do want to point out that right now, uh, there are some resources that are available to you. For example, Grateful Veterans, which Jeff represents, is available. They help not only veterans, they help them be able to get a card, but they also have a number of webinars, seminars, and direct personal contact with you that can help you quite a bit. And also the Blunt Joint, which Manny puts together, is one where it does counseling. He's in the Pensacola area, but he can be available anywhere, candidly, in the southeast of the United States to help folks, and of course nationally with the phone calls. I do want to point out that Manny and Jeff, ironically, tonight are now helping other folks and won't be able to make it for the Q&A. I got some text messages while we were doing this. Welcome to the world of PTS and basically what they do, which is helping a number of people. Amy, you also work with Medical Marijuana Treatments of Florida. They help with people being able to get a card. And I think that's something that's important with the 22 clinics that are out there. Tell me a little bit about MMTC.
Yeah, certainly. So we are a full service medical cannabis doctor's office. What we do in the state of Florida is qualify patients to be able to purchase medical cannabis. So our doctors are going to sit down with you, review your medical records, make sure that you have a qualifying condition, and then they're going to go over the risks, benefits, pros and cons of medical cannabis for that patient. And then afterwards, that's where I come in. I'm one of our patient educators. And so I help patients with applying for their card with the state of Florida, and then kind of getting them to the point where they feel comfortable going and making purchases, and then starting to create a treatment plan that will hopefully work for them.
So we've covered a number of different topics. I do want to mention that after this webinar, you will get now that being said, why don't we jump into some of the questions that we were asked prior to the webinar, and we'll get those questions. And Amy, you help me answer some of these. I need your wise counsel on this. The first question is, which terpenes help best for PTSD and which method of consumption? Tell me a little bit about this. What would you recommend?
Yeah, certainly. So we would generally recommend terpenes that don't have a propensity to give you energy. So we're looking at things that are going to be more calming. That's going to be the myrcene, caryophyllene, linalool, perennial, something that is just going to help relax the body, relax the mind. So we're not trying to energize people when we're trying to treat PTS. We're just trying to get them back to like a level area where they can deal with what they need to deal with and go on with life.
Well, the second part of the question comes into what method of consumption. I think we're going to jump into that in just a moment, answering the second question that's coming up. But I do want to point out these terpenes are really, really key. And when people ask which are best, these are kind of the big six that you should really look at. And I think by going in and paying attention to, myrcene is something that is almost in all cannabis products, so you'll find it quite popular. But I think you're going to also find caryophyllene is one of the popular ones. And again, mood elevating, is eliminating during the day. It'll really help you really quite a bit. So let's jump into the second question, which is PTSD sufferers are prone to sudden anxiety attacks. How can I combat that with extended release type approach so I don't avoid spikes? I think this goes back to being able to use a product during the day that really covers your entire range of when you need cannabis. And I think, Amy, this is really, really key because really there's different onsets and there's different durations, and really being able to mix and match these during the day really can help you put together a program to address you effectively. I know I myself have herniated discs in my neck. They're not going to go away. So I have to pay attention to what I'm taking in the morning, afternoon, and evening. Tell me a little bit about this, because you work with people when you put these together.
Yeah, certainly. So this is a big part of what my job is. So what we're trying to do is cover as long a period of time as that patient needs. Some patients are just looking for something to help get through the workday. Some people are helping for something for 24-hour coverage. So for a lot of patients, they're not looking at using just one type of product. So for example, they might start off the morning by taking a small dose from a vape just to help manage their symptoms right away. But at the same time, they may also take a small dose of an edible with the idea that the vape isn't going to last a very long time, but we know that the edible is going to take a while to take effect. So while that edible is coming up, that vape is going down. And the idea is that we're trying to find that nice level area in the middle. And that's kind of where we like people to stay is a spot where they're comfortable, they can function, they're not having unwanted side effects. So it is trial and error. It's a lot of trial and error just to figure out the timing of products that works for the patient, the route of administration that they're comfortable with. Because say, for example, a patient, maybe they smoked 30 years ago, and the thought of smoking something now is really a turnoff. We just inhaled products for them since it might bring up some kind of negative feelings and not be comfortable for them. So feeling comfortable with the different routes of administration that they're using is always super important.
And I think this will also help you avoid what is referred to here in the spikes, being able to keep that level. Like, for example, I try to keep myself with a pain level of below 1 on a scale from 0 to 10, and being able to stay there during the day helps me be able to work effectively. But I got to pay attention to the onset and also the duration time to make sure I have a regime that makes some sense. Let's jump into the next question. And that question is, does this also apply to CPTSD? Now, CPTSD means the complex PTSD. That means normally there are a number of different symptoms that that you're trying to address. The answer is yes, this does apply to CPTSD. In fact, it's very, very, how should I say, it's very interesting that with the endocannabinoid system, what it's doing is it is identifying where you need the help, and it's being able to send the endocannabinoids to that particular part of your body. And again, if you have an active and a healthy endocannabinoid system, it will be able to help you manage these symptoms, but you need to have those endocannabinoids. And if your body's not producing enough of them, the phytocannabinoids really help be able to really charge that battery and get the products that you need. So I guess the question becomes, one of the couple questions that come into this is, what type of cannabis is best for PTSD, indica or sativa? I think the answer really is, Amy, maybe you can help me with this. I think the answer is really getting the right terpenes. And really the question is, what environment are you going into? I know indica makes you relaxed and sativa gets you active. You want to be able to pay attention to, do you want to be active or do you want to slow down as to which type of cannabis that you want to use? Your thoughts on that?
Yeah, I would actually agree with you. So I'm not a huge fan of the classification of indica, sativa, and hybrid, because all it is the expected effects of the product, but it doesn't take into account dosing at all. And I think more than anything, dose is very important, especially when you're talking about any cannabis related product. Too much of an indica could also produce feelings of anxiety, just like a lot of people have this idea that sativa is just going to give you anxiety and make you really hyper. It's really not. It's very dose dependent. So I would tell patients, try different products. And if you find a product that works well for you, consider asking the dispensary for the COA or certificate of analysis. That is going to be the lab testing that's done on the product before it's ever brought to market. And that COA is going to tell you exactly what is in that product. That's really helpful for figuring out what terpenes are going to be most beneficial for you.
One of the other questions that comes up here is, has trauma been found to alter one's DNA? How can cannabis help? I think really cannabis is not designed to go in and alter your DNA. What it's really designed to do is really help you manage the symptoms of that trauma. Your thoughts, Amy?
Yeah, I would agree. We're not trying to change anybody on a molecular level here. Cannabis is a tool that can be used in a lot of different ways, but it is just that. It's a tool. A lot of patients use it to treat very specific symptoms, and using that tool effectively does take time. It takes time to figure out what dose works for you. It takes time to figure out how often you might need to take a product. It takes time to figure out how much of a product, but it is just a tool. That's what it is. It's not going to change your DNA or anything, but it's just a tool to try.
Now, the next question I think is a great question. I don't know who asked it, but I'm really glad that they did. It says, how does a person who grew up religious come to terms with needing cannabis to function? My PTS is unmanageable without it. Well, I want to make a comment, two comments if I can, and then we'll dive into this. First of all, cannabis is a plant that acts as a medicine. It is not a drug. It is not manufactured in a lab. This is a plant that works in harmony with your body. It's natural. It's not an artificial substance like a lot of the pills and pharma drugs that are out there. And it's something that's been used for centuries. So this is a natural product, just like echinacea, just like a number of other products that are out there. It's not a drug. I think that's the key. And a lot of the religious backgrounds really want to be anti-drug. But what's fascinating is if you go through the Bible, there are 3 references of the Bible that talk about cannabis being used positively. And actually, there's no reference that says, yes, you should be using cannabis, but it talks about examples of where cannabis has been used to be basically to be able to help a lot of people. So it's not that you're violating any religious beliefs. In fact, if anything, if your religion is one that really believes in nature and doing things with harmony and homeostasis and helping people, it probably fits into that category. Amy, your thoughts on that? I mean, this is my opinion, and I'm just giving you my opinion. Your thoughts on that, Amy?
So the way I would approach this is the same, pretty much the same way that I would approach a person that comes to me who has a lot of reservations based on growing up during the war on drugs.
Yes.
Really ingrained in our society that drugs are bad. You know, drugs are going to make you stupid. We are just now waking up to the fact that maybe that wasn't quite right. So it is giving ourselves some grace to maybe admit that we didn't know the full picture when we were forming these beliefs. But I don't think you can view it as a negative thing. Like using cannabis shouldn't be a negative thing in your mind. It should be a tool that you're using to help deal with things in your life that you're not able to maybe manage or deal with on your own, or you don't have another safe outlet for it. It is just a tool. How we use it determines the effects. Of course, there's going to be people that get super high and blasted off into outer space. That's not medical cannabis. We're
Yeah,
using it
exactly.
as a tool to treat specific symptoms. And when you view it as a tool, it's kind of hard to it being a negative thing. So
Right.
I don't come from a religious background, so I don't have a great input on this, but that's at least, how I view it.
Okay. Yeah. I come from a very strong Roman Catholic background. And I do have to tell you, I've talked to a number of my colleagues, I've talked to a number of priests and folks that are in there. And really, cannabis has been part of our culture. I mean, not just our culture, meaning as a human race for a long time. A lot of the Eastern religions actually have cannabis built into a lot of the rituals that are out there. So it's not a negative, it's a positive. And again, understand that this is a plant that acts as a medicine. It's very natural. You're not taking drugs. What you're doing is you're taking something that is really hopefully going to help your body. Let's jump into some of the live questions that came in during the webinar tonight. And let's see, what's the first one that jumped into here? Oh, is it that we come to have deficiencies? And does anybody have them? Does anybody have them should be partaking with medical marijuana? These deficiencies come, let me give you an example. I'm a senior citizen. And as a senior citizen, my body doesn't produce as many endocannabinoids or as much as it did when I was younger. And so I don't necessarily, I'm not necessarily totally deficient, but I'm not necessarily, my cup isn't really filled to the top where I really need to really help. I think anybody over the age of 50 really needs to take a look at trying to use medical cannabis to really address a lot of the issues of your body. One of the primary ones being inflammation. I mean, senior citizens are just inflamed animals that really have to deal with a lot of this. And I think bringing that inflammation down helps quite a bit. And should anybody be participating? Yeah, this is my personal opinion, but it's also the opinion of a lot of doctors that if you're over the age of 50, the CBD especially is really good to help with being able to help the receptors of your body manage a lot of different issues, not just inflammation, but your blood pressure and other things. Your thoughts, Amy?
Yeah, I actually agree with you. As far as how do we come to have deficiencies, I think you're right on the money. As we age, all the systems in our body don't work as well as when we were very young.
Sure.
As far as, does everybody need to use medical cannabis? No, I don't think so. I think it's just a personal decision, and it's, if a person wants to see if cannabis does improve their life, then I'd say go for it. Because we know that the risks associated with medical cannabis are so low, the like the downside of it is there really isn't one. So if there is somebody, who wants to try it, I don't see a reason for them not to, as long as they're a physician that agrees that it's safe for them to do,
Right.
then they should go for it. But as far as deficiencies, it's age related,
I think there's another issue too, and that is that if you have some sort of an injury, and I'll give you an example, I had my left knee replaced, and I went to a very well-known clinic to being able to get that. And one of the problems with this is really a pain. It's really a situation where my body is now going to be put into a situation where it needs the endocannabinoids, but it needs more than the average amount of endocannabinoids because they're fundamentally replacing my knee, cutting off my knee and putting it back together again. That's the bottom line. And so I needed to be able to use medical cannabis to give my body the phytocannabinoids to be able to produce the endocannabinoids it needed to be able to address the pain and the inflammation in my body. So injuries, whether you have an operation, whether you have an accident or something like that, you won't be producing enough endocannabinoids or not fast enough to be able to address that inflammation and pain, and that's where medical cannabis comes into play. Now, I do have to tell you, when I did my knee replacement, I worked with this clinic, and what they did was I actually used medical cannabis, and I worked with, we were a test group that had 4 other people, and they were using pharma drugs. And I was able to take my pain level down to less than a 1, literally the first day after the operation. And I kept it that way really through the whole experience. What's interesting is when we did this test where we were comparing pharma drugs versus medical cannabis, after 2 weeks, I kept my place safe there. One of the participants on the pharma side came over to medical cannabis 2 weeks, and 3 weeks after that, so did the second one. One person dropped out from the pharma group, and by the end of the experiment, we had 3 people using cannabis and 1 person using the pharma drugs. And what happened was, what they realized was they could manage the pain, they could manage the inflammation, and they didn't have the negative side effects that they got and the potential of addiction that you had by using the pharma drugs. So I think it's a matter of, does your body have enough? Think of cannabis goes into your it's stored in your body. Think of it like a battery. And what you're doing is you're putting the energy into the battery. So when you need that charge, your body can take that out and be able to use it. So I hope that's there. Lisa asked a good question. Can I have a copy of the chart? And the answer is absolutely. You'll get an email as a follow-up to this that'll have a copy of that chart. And you'll also get a link to the flipbook version of this presentation where you can go through and look at any slide and, of course, take any one of them and print them and be able to take a look at them. So the answer is yes. We want to get out to as many people as possible this information. Our goal is to help you get your life back, and hope this chart helps. We're there. Christina asked a question: at what point does daily use and daily usage consumption turn into an addiction? Excellent question, Christina, because the question is, what is addiction? And we're going to do a whole seminar on this in I think it's June 9th that we're going to do it. June 4th or June 9th. I have to figure out the first Wednesday in June. And we're going to be talking about cannabis use disorder, and we're going to be talking about addiction. Now, addiction is something where you're addicted to something, you cannot give it up, and also you're in a situation where if you do try to withdraw from it, it gives you some sort of a negative side effect physically. And I say that when you look at opioids, you look at heroin, you look at a lot of the Percocets, the pain pills that you get, and things that are out there. These have some very negative side effects. In fact, a lot of times when you look at the commercials on TV, they'll give a long list of things, and at the end, they'll give you some things about addiction and death. Let me contrast that to my particular situation. I have a situation where I'm taking cannabis because I have 7 herniated discs in my neck. It's inoperable. Well, I shouldn't say it's not inoperable. We can operate, but the chances of me coming out of that operation without having some sort of a handicap is less than 10%. So we decided not to do that, and I had to look for alternatives to manage my pain and the inflammation that's from that. I can stop. I stopped taking cannabis. I started taking cannabis. It started working. I got my inflammation down, my pain down. I've got back. This is like 6 years later. I now have 95% of my body motion, and I live in a world where my pain level is less than a 1 and my inflammation's down. Now, every 4 to 6 weeks, I will take about 2 days off from using medical cannabis. And the reason I do that is because what I'm doing is I'm letting my body be able to recharge itself. My body will get a little bit lazy and doesn't really work as fast as it should be. What happens is by taking a time off, it realizes they got to go back to work. It recharges the endocannabinoid system. Now, during that period when I stop, I have no physical reaction to that at all. What does happen though is after about a day and a half, my neck will tap my shoulder and say, you better do something pretty quick because the pain's going to come back. I'm not addicted to cannabis from the standpoint of needing it, from the standpoint of I have to have it. What I have to have is I've got to get rid of the pain in my body. If I don't take cannabis, I'm going to be at a level of 7 or an 8 as pain on a scale to 10 very, very quickly, meaning within a day or two. And so I'm not addicted to cannabis as much as I'm addicted to getting rid of the pain. And the nice part about it is I can stop at any time, and there's no negative side effect to doing this. A lot of the addictions that you see out there, again, I'll use cocaine, heroin, opioids, even tobacco, you really can't get off it. And if you do, there's some negative side effects from the standpoint of your negative reactions. So again, I draw that distinction. I'm really doing something to medically treat myself, just like a vitamin pill, to being able to do that. Can I stop at any time? Sure, I can stop tomorrow, but I better look at some other alternative for the pain, and that gets me back into the pharma world, and that's where I really do worry about physical addiction. Your thoughts about that, Amy?
I actually fully agree with you. The way that I view it is addiction comes with a level of harm. And when patients are using medical cannabis, they're using it to treat specific symptoms. You, of course, are going to have patients that are going to use cannabis to excess. That's their choice. They're an adult. But for the patients that are using it as a medication, the chances of becoming dependent on it are extremely low. But I think you had a fantastic analogy with your neck. You're not addicted to the substance, you're addicted to not being in pain. And that's pretty powerful.
Yeah, and I think it's a lot of the addictive drug, the pharma drugs that you get involved in, it's a slippery slope because once you get into that, you really can't stop without some sort of a negative side effect. Let's jump into the next question. It says, what do you recommend for starting medical marijuana when you're currently taking multiple prescription medications, example meds for depression, anxiety, nightmares, insomnia? Amy, you've never heard this question, have you?
No, never, never. So what we would normally recommend, of course, with any person that's starting medical cannabis, we're always going to recommend starting at an extremely low dose and then gradually working your way up. What we would usually recommend is you are not going to stop or change any of the medications that you're currently on. What you'd be doing then is supplementing those medications with the cannabis. So cannabis is being used in that case to help control symptoms that aren't being controlled by your other medications. Now, if you get to the point in your cannabis treatment where you find that your symptoms are well controlled with cannabis and the medications that you're on, you could then at that point talk to the physician that recommended or prescribed those medications to you about doing a gradual dose reduction. That is when your doctor supervises the lowering of your dose, and it's done very slowly and with doctor supervision. So our big thing is we don't want you to stop or change any of your medications. Start low, go super slow in the beginning to see how those medications feel when you're using cannabis. And then if you get to the point where you're finding helpful benefits, maybe you found a spot where your symptoms are well managed and you'd like to talk to the physician about a gradual dose reduction, that's the way to do it, because that way every single part of the process is being managed by a physician, which is truly the safest way to do it.
Let's go to the next question, which is, does cannabis work on nerve pain? And I will say absolutely. And Amy, why don't you maybe take this a little bit, because you've seen a lot of people who have that pain, and the routes of administration and the really make a big deal, or make a big difference, I should say.
It does. So we definitely have patients that have neuropathy, post-herpetic neuralgia. There's a lot of different neuropathies from a lot of different things. Some of the easier products to get into are topicals. Some patients do have a lot of success just applying a topical to that area. If a patient is looking for something that's maybe a little bit faster, they might look at an inhaled product like using a vape or smoking cannabis like a joint, or they might have better luck with something like an edible.
Mhm.
In the end, as far as routes of administration, it's always going to come down to what the patient is most comfortable with. So again, if you're not a smoker, you've maybe quit 20 years ago, we're not going to recommend an inhaled product for you.
Mhm.
And it might be sticking with the tinctures, it might be sticking with edibles, it might be sticking with a topical to help control that nerve pain. As far as terpenes for nerve pain, I would tell you to go with the big ones. Caryophyllene, pinene, myrcene, limonene are always the big ones.
Mhm.
Uh, they tend to have a good profile for inflammation. So they're really great anti-inflammatories, which can help with nerve pain. But it is, again, always going to come down to trial and error. So if
Mhm.
you find a product that is helpful for you, again, I do recommend asking for the COA or certificate of analysis so that you know specifically what is in that product. And then once you can figure out what that terpene is in that product that's beneficial for you, then you
Mhm.
start looking for other products that have that same terpene.
And look, with 780 discs in my neck, but that is nerve pain. There's a lot of it. And let me, and also, I had bone on bone when they had my knees. Basically, welcome to being a guy and wearing out your knees. But the point is, it works. And when you're using, we talked about dosing, as you're going up and going low and going slow, and you're increasing. At one point, I mean, I literally got to a point where my pains went away. And it was like, wait a minute, my pain is going away. I hadn't had that experience in 25 years. And what happened was it got to a point where I really felt good. As I continued going high, using a little bit more, I wasn't beginning to feel good again because cannabis is biphasic. So by backing down, I found my therapeutic dosing level, and it worked really, really great. But the answer to your question is yes. Again, pay attention to the terpenes, go low and go slow, and then use a route of administration that you're comfortable with. Okay, question is, how do you know if we have cannabinoid deficiency? Are there actual tests that can be taken, and who conducts them? Well, you can go to various groups that will test your body for different things. I can tell you, if you're over the age of 50, you're cannabinoid deficient. That's been tested and known. The Israelis did a lot of studies, so did the Canadians on this particular issue that's there. I would say that if you're in a situation where you have a lot of different situations, like for example, anxiety, stress, migraines, for example. A lot of folks that have migraines, they've done a number of studies. They've had some great studies, two of them that have been done in the last year, about how migraines are directly related to cannabinoid deficiency. So a lot of the times you'll know it's there because you have let's just say the condition that really shows up that's there. I'm not aware of any actual tests that people do, but I do know that there has been some work that's been done in the labs. Again, I mentioned in Canada, also England, and in Israel.
I agree with you. I cannot think of a specific test that would be done. We kind of identify the deficiency by supplementing with cannabis and then seeing what effects it has, which is not the most scientific or rigorously um, helpful way, but it's one of those things that you might start having pain, you might start having
Right.
anxiety as you get older. If you were to take a cannabis product and you find that it helps those things, there's a chance that you could have a deficiency.
Mhm.
When we talk about deficiencies in the endocannabinoid system, it's in a very general sense. It's not like you have a deficiency of iron in your blood. We're going to measure that, and then the doctor is going to suggest a specific amount of iron to take every day. It's
Mhm.
not quite like that. It's a little bit more amorphous than that. It's more, we see a problem, we're going to try this as a solution, and then we find this to be helpful, then we know that there was, something there that it did. That's pretty much it. It's trial and error.
Yeah, and I think again, if you a lot of the conditions will tell you that you're cannabis deficient, and that really is a real key indicator. I don't know of any actual test that's out there, but I do know if you're over the age of 50, you should consider this. And again, there's a lot of research that I should say some research that's been done both in Israel and also in Canada on this. Yvonne asked a very good question. It says, my son was diagnosed with PTSD a year ago. He smoked weed for 20 years. Should he quit and start again using guides to help him with PTSD? Remember the chart that we showed you that had how terpenes were very heat sensitive. If you smoke weed, a lot of people do, you make what they call a joint or a blunt, and you take it and you light it with a lighter or a match, and you're putting a 550-degree flame up to this particular cigarette, or let's just say this joint. What it does is that 550 degrees, it burns off half of the cannabinoids, almost all of the terpenes, and almost all the flavonoids. So you reduce the medical efficacy of that particular blunt or that joint about 50 to 60%. That's the bad news. Now, the good news is it still works, okay? But you got to take more of it to get the amount of assistance that your body needs to be able to go there. What I would suggest that he does is sit down with a medical cannabis practitioner who can actually walk him through this and help him be able to find out the right terpene profile, getting the right cannabis that has the right terpene profile to address this particular condition. Because if he's buying the stuff off the street and he's using it, he doesn't know what's in it. And in many cases, a lot of folks that I work with that say I've used cannabis, it doesn't work. When I look at what they're using, the terpene profile doesn't match the condition. So you're not going to get any relief that's out there. So I'd say really sit down with a professional, somebody like Manny, somebody like, like ourselves, like MMTC, those kinds of folks to really walk him through that. I think the other is they're going to probably talk to him a lot about changing his route of administration. If he's smoking weed, take a look at dry herb vaporizers. They're kind of cool, from the standpoint of socially, but they also they're vape. They're not a burnt material, so they're easier on the lungs, and also they really allow you to tune in those terpenes because you can be able to set the temperatures. Your thoughts on this, Amy?
I agree with you. So I think addressing route of administration would be helpful.
Mm-hmm.
Um, I would also consider talking to him about doing a cannabis holiday or a tolerance break,
Right.
because there's a really good chance after 20 years that his tolerance is really high. So he might benefit from just taking a couple days off to help reset his system. And then again, starting at a lower dose and then gradually working up to a dose that works well for him again. And just like Mark said, I'm always going to suggest a dry herb vaporizer over smoking cannabis. Um, it's the difference between lighting something on fire and heating the flower with conduction and convection, and you're actually left with the plant material over afterwards. You're not left over with ash. You actually have the plant material. So you're getting a lot more medicinal benefits from cannabis by using a dry herb vape.
Mm-hmm.
But that, along with a possible tolerance break, see how he does.
I think the tolerance break is an excellent recommendation. I know that they talk about a tolerance break should go about 4 days, maybe 5 days. I can't do that. I go about a day and a half and then I get into pain, and that's not where I want to be. But really taking that 4 or 5 days, and maybe even in his case, a week or two could really help reset his body. I think a longer tolerance break would help. What do you think, Amy?
I would agree. I don't think he'd need a very long tolerance break, but again, it's very individualized.
Mm-hmm.
And for some people, instead of taking a full tolerance break, they may actually switch from high THC products to high CBD products just to help get them over the couple days of not having THC.
Yeah.
By still giving your body those cannabinoids, it can be a little bit easier to get through.
Now, Kathy asked a question. I think this is our last question, and that is, what's the best terpene for PTSD? I think it's not just a terpene. I think it's a number of terpenes working together can help. Amy, your thoughts on this? What do you think the best terpene is? I have my preference, but I'll let you take the lead on this one.
Certainly. So I think this is very individualized to the patient. And what works for one person is not guaranteed to work for another person. This is figuring out what terpene is best for a patient. This is best done by using a journal. writing down what you used, how much you used, how, like when you felt the effects, how long those effects lasted for. And then when you find a product that is meeting your needs with minimum side effects, that's when you get that COA or certificate of analysis, because that's going to tell you specifically what's in that product. And it'll be a lot easier to narrow down what products are helpful and specifically what terpenes are helpful when you can figure out what was helpful in general just by keeping a journal.
Yeah, and we just put up a slide of the terpenes that are there. One you mentioned when you mentioned it's individualized. Every person's body is different. What's interesting is the cannabis that I would take is not necessarily the mixture would work with my wife because her system is different than my system, and so that's why there's no take two pills and call me in the morning kind of a solution here. But in reality, there is kind of one of those because your doctor, when he gives you the pills, is just trying to give you the minimum dose and have you figure out how to go low and go slow from there. And we're recommending the same approach. What we're recommending is try different products. Now, the reason that when you look at a cannabinoid, you look at a profile, let's say you get some flower, you'll see myrcene, caryophyllene, linalool, terpinolene, bornolol, limonene. You'll see different terpenes that are in there. And being able to mix and being able to see which one is dominant, in other words, there's a higher concentration of it, maybe 1.75 to 1%, maybe 1.25%, versus one that's maybe just 0.10% or 0.1, I should say. You'll be able to find out which ones feel better and which ones work best for you. I would think my particular approach is you'll probably find that myrcene will do a great job. And then depending if you want to be able to be relaxed, which is linalool comes into play, or if you need to be energized, limonene will come into play. And then also make sure that beta-caryophyllene is also there. Every person's body is different, and we have to respect that with being able to come up with the right that therapeutic dosing level is getting the right product that's there. Your thoughts on that, Amy?
I agree with you. It's very individualized. It's a lot of trial and error, and figuring out specifically what terpenes work well and what products work well. It's truly the grind of medical cannabis.
Right.
It's really one of the only downsides of it is it does take trial and error.
Right. And you usually get that done within a week or two. That's the nice part about it. So I think we've answered most of the questions.
I would always recommend if you are feeling like you're having symptoms of PTS or PTSD or even CPTSD, please talk to a qualified person, whether that is a psychiatrist, your physician, a psychologist, a social worker. Find out what resources are available and start treating the things that you can in your life, and then consider cannabis as a way to help control symptoms that you might be having. Of course, I am always going to recommend using a treatment journal. Start low and go slow, and then just be mindful of how much you're using and how frequently, and then be reflective about how you're feeling when you're using it. It's a good way to just kind of make sure that what you're using is beneficial to you.
Amy, that's sage advice, and I want to thank you very much for that and all the advice that you've given for being on tonight. I know that I can tell you as a guy, as a professional athlete, somebody who is got to be number one, got to practice and got to get there. Journaling was about as far from my mind as it ever came, and yet I found in medical cannabis it made a huge difference in being able to get the relief that I want. Our goal is to help you get your life back. And if we just help one of you get your life back, we've accomplished what we wanted to tonight. And if we can get more than that, then we're absolutely elated. But thank you very much for joining us. Again, pay attention to resources like the Blunt Joint and also the Grateful Veterans that are out there, as well as MMTC in our channels, because what we're really here to do is provide support to you. Because again, our goal is to help you get your life back. I'll give a shameless plug for our arthritis webinar next week. It's going to be interesting because really arthritis is something that affects a lot of people, and we'll be taking that on. So please join us for that webinar and some of the other webinars that are coming out. So listen, Amy, thank you. And I want to thank everybody for hanging in there, and we hope to see you next week.